Earlier this month, Ana Velia Maldonado from Monclova in northern Mexico lost her father to the coronavirus. He was exposed to it in the town's public hospital while visiting his brother, who was unknowingly being treated in the same ward as the town's COVID-19 patient zero.
Everything was normal. There were no checks. You could just walk around like nothing was wrong. We didn't see any doctors with face masks, but everyone knew that patient zero was there in the ward.
The reason that Anna saw no alarm in the ward was because the hospital's administration apparently ordered it that way. Staff here told us they were prohibited by managers from wearing face masks to prevent wider panic. Administrators refused our request for comment, but that early misstep helped turn Monclova Hospital and the town itself into one of Mexico's pandemic hotspots.
I think by this point it's unstoppable, because the chain of infection is outside the hospital now, and we don't know who might be infected.
At least 7 Monclova hospital staff have now lost their lives to the virus, and a further 60 have tested positive for COVID-19. Dr. Mario Davila is a pediatrician who works regularly in the hospital.
At the time, the virus was not suspected, and proper preventive measures were not taken. And then, when it was discovered that the patient had signs of pneumonia, it was already too late. And now our city is in phase 3. The virus is not limited only to the hospital, but it is outside the community as well.
The city of Monclova now counts for more than 50% of Coahuila state's confirmed cases. With infections on the rise, state authorities are erecting a pop-up ward beside the hospital to expand capacity.
I
have seen how our town's medical workers are working to save lives, but the public aren't helping by ignoring what they're told to do. And I'm worried that our doctors might lose the will to keep working for fear of being contaminated.
As Monclova deals with the fallout of its ill-advised anti-panic policy, it's serving as an example to other communities of what not to do in the face of a pandemic. Alistair Baverstock, CGTN, Monclova, Mexico.